Lots of options. I know I'm probably missing out on some fantastic programs out there. Please reach out, tell me about your program. I'll spread the word. That's what it's all about, is working together as a team to get this mission moving forward and hopefully becoming a standard of care. ACSM's made it a goal to have exercise oncology or exercise included oncology as a standard of care by 2029. Some personal insights here, and some, I guess, nuggets of information that I've learned over my 10 years. First and foremost, we really want to make sure that we're using transparency and a bit of behavioral coaching at the beginning of our journey, as we talked about earlier. I'll still hold off on getting too deep into motivational interviewing. I'll cover that more at the end. But we want to make sure that we're giving our terms and clarifying the commitment of what this program is going to be for the patient, clarifying the plan of action for exercise oncology programs, the times, the dates, the prices, all of these details right at the beginning, because as we well know, folks are getting a ton of information, and a lot of it just literally is in one ear, out the other, or over their head because they've just had that C word thrown at them, and their life is probably spiraling in different directions. So it's important that we really clarify what the plan of action is going to be at the beginning, right away. I always ask for a lot of patience, a lot of grace, and a lot of communication from our participants, knowing that they're going through this journey, and we have to be able to make this adaptive day-to-day adjustments for their exercise plan. I tell them they got to be the pilot. I'll be the autopilot, and no one knows their body like they do. I also use that motivational interviewing approach to draw out goals from them that are relevant, relatable, and realistic. That's my alliteration for you today. So making those goals relatable to them. We'll talk about how we can use some strategies to make this more relatable to wherever they're at in their journey, or wherever they've been in exercise and fitness, making it relevant to their specific needs, and then making it realistic, as we know well from the SMART acronym for goal setting. I also want to validate their feelings and make sure that we take our time to track and celebrate even the small successes frequently. I think this is one of the biggest upsides of using groups, or getting folks to work together in a group environment. It offers that relatability and validation, and more chances to celebrate, more chances to see other folks' struggles and overcoming those struggles. We'll come back more to that later. It's important that you start to begin teaching self-regulation and giving practice for self-reflection, practice opportunities to self-reflect. And I always do this at the beginning of every warm-up and at the end of every cool down, and giving them that moment to I liken it to leaving the bags at the door. Whenever you come into the gym training setting, it's most important that you're spending your time on yourself. This is self-care time, and you can pick up those bags much stronger after you leave the gym if you've focused on your body and your needs. So it's a daily needs assessment, and the understanding that progression is not always going to be linear with the cancer demographic. There's going to be times when, say even in survivorship, if they've had radiation therapy, it may be 6 months later that they start to have impacts or feel the side effects of that radiation therapy. So periods of dose reduction or maintenance and even regression are common to accommodate the needs of the patient. Goals may shift from progression to simply prevention of decline. It's important that we use increments and increasing volume and frequency rather than intensity to help maintain those levels of activity and maintain those higher levels of endogenous medicines flowing through their system. I like to include a lot of postural supportive strength and flexibility in especially for the posterior chain, because a lot of the surgical interventions and even radiation interventions have traumatic effects on the tissues on the anterior chain. So postural supportive strength and flexibility training are key. And then I also include education and practice with low intensity exercise or activity, like recovery techniques, for instance. Simple aerobics, that's something that we hope to coach and encourage that they do light aerobics every day. Massage techniques or self-myofascial release, obviously needing maybe a bit of therapeutic oversight there, but if they're not receiving that therapeutic oversight, it is within our scope of practice to show them how to lightly massage and help recover through between bouts of exercise, stretching, balance and coordination. These lower intensity exercise activities will really help to manage stress and show them the benefits that something is better than nothing on days when training heavier may not be an option. The incremental approach to strength and aerobic training volumes is really it's vital, but we have to understand that it may not always be a progression. One of the things that I value the most, and if you have followed Dr. Newton, you know his background is also in strength and conditioning. That's something I value a lot in my experience, is I had the opportunity to work in higher performance levels with various strength and conditioning periodization models. So knowing that it's not always going to be linear, you can apply different types of strength and conditioning models and pull those tools out when you need them from day to day. Learning how to tailor specific programs to an athletic schedule was another valuable learning opportunity from the strength and conditioning world. We had to tailor their training to in-season preservation or restoration of performance, and then off-season performance enhancement. And I think that's really important learning experience to bring to the cancer realm, where you're going to need to be making adjustments maybe day to day. I like to track skill efficacy, skill-based and also skill and will, obviously. We want them to have the motivation and accountability to keep showing up. But I think it's important that we track their skill efficacy and develop programs that show them their progress and hopefully encourage them to keep with it over time. We all know that accountability and motivation are probably the main thing that people hire a personal trainer or a fitness coach for. And it's really about improving the longevity and adoption rates across the lifespan. And this would be a great place for you to partner with community-based programs that are quality vetted. And I think we're probably all on the same page, understanding that the diverse backgrounds and lived experiences in the cancer demographic require that we create inclusive and welcoming environments. We need to make sure that we're sensitive to the general cancer journey, but also specific to the stage that survivor may be, or that patient may be in, their age, their gender, cultural, ethnic, and socioeconomic backgrounds. We have to be both prepared with standard operating procedures that help to create more inclusive environments, but we have to treat them as an individual and meet them where they're at there as well. I also think it's important that we consider their caregivers and maybe offer some wellness resources and initiatives for caregivers as well. And then finally, we want to afford many opportunities for communication and fellowship with other survivors or patients on that journey. It is absolutely invaluable for them to be able to connect with other patients, and whether it's in the support group or in the exercise environment. I'll talk more about how impactful it can be in the exercise environment, bringing people together to build their strength and re-solidify some of their confidence. But, flexible formats and offering different options for their engagement, for their fitness. And maybe that's not something that your systems-based program offers, but having those resources ready and showing them that there's a path to continue down the road can be tremendously impactful to their adherence. And then using kind of a weighing of the program format to the needs and benefits specific to your common demographics, you may be able to incorporate things like virtual training for those who are immunocompromised or have rural accessibility issues or potentially even financial affordability.